Thank you, Mr. Chairman, and thank you all for being here. We really do appreciate you, Dr. Stone, and your team, and really all of those throughout the system that have worked. They work so very hard anyway, and in the midst of a pandemic, you mentioned that you truly have a huge system, an unimaginably large healthcare system. We appreciate all that you've done, and also in being, I think, forward-thinking and dealing with the problems, the telehealth, the telemental health. All of that has been a great success, and again, that's the ability of your team to really adapt and ramp up. So we appreciate that. I agree with Senator Tester about the concerns of PPP, but the problem is that as we reopen, I know, I'm talking to daycares, they're starting to, they're being required to have all of this stuff. All of our businesses, as we reopen, we're still required. People are getting out more, so they're wearing the stuff more, rather than sitting in their homes. So it's just a huge problem, with the demand versus what even as we ramped up, and it does tend to, in my mind, think of the importance of perhaps doing the stockpile that you suggested that we used to do. Do you need any additional authority to do that?
Karen.
Thank you, Senator. At the time, I don't think, what I would offer is that at least we have some, the authorities we have in place today will provide what we need. But we do need to make sure that VA is at the table anytime there is discussions with relationship to healthcare support across the nation. That's one thing this pandemic has provided, but the authorities we have today will meet our needs.
So let me just add, sir, one thing, and that is following Desert Storm, DOD was given an authority called War Stopper. War Stopper allowed them to pre-commit inventory from a manufacturer. When you heard about DOD committing 10 million masks to FEMA, that came from War Stopper. And what it does is allows DOD to pre-commit that inventory. It's kept in a warehouse, but the manufacturer actually rotates it and keeps it fresh so that if it begins to go towards expiration, it is a guarantee at a fraction of the cost to keep that fresh. We believe having that type of authority would be very beneficial to VA also, or to allow us to partner with DOD to actually execute that.
That was really going to be my next question. Can you assure us that that would not be the case? Because sadly, we've had some instances of that, during this crisis, that we found that the stuff was pretty old and maybe not where we'd like for it to be. So that's good to know. Tell me about the IG report regarding delivery orders and things. There was some concern there. I think they found that a significant percentage perhaps were getting the wrong stuff. I think there was an IG report in December. Is that correct?
You want to take that?
The Medical Surgical Prime Vendor Program.
Andrew, do you have that one?
Senator Boozman, I'm not quite sure I understood the question, that there was a shortage or an inability to get material.
They reviewed delivery orders and estimated that the medical centers received incorrect orders about 60% of the time. So significant number.
Sir, I'm going to have to take that one for the record. I am not familiar with that report.
Very good. Are you adopting the Department of Defense Medical Logistics Standard Support System? Does that ring true? Are we upgrading that, or?
Well, we're going to adopt DIMLs. DOD is in the process of doing a tech refresh. That tech refresh is called Logical. So we would begin fielding DIMLs, and then we would switch from DIMLs to Logical.
So would that help with that kind of a problem?
It would help with that kind of a problem because we have much better ability to track everything that we're doing inside DIMLs. GIP does not give us that opportunity. In fact, our supply techs need to swivel between systems. They have to work in multiple systems at one time for a single order to make things work. In DIMLs, it will all be done in one box.
Right.
Much simpler.
So as the Secretary has discussed extensively in previous testimony, because of this fractured system, a large percentage of our purchases are done locally at medical centers using government purchase cards, with literally billions of dollars traversing those government purchase cards. So it's very difficult for us to track those, as well as to track the contracts that are being used and to assure the validity and the transparency of the system that you expect.
Okay. Thank you, guys. We do appreciate you very much.